Hi, also let's talk about Vecuronium infusion today. So, Vecuronium is a non depolarizing muscle relaxant. It helps with the neuromuscular blockade. So, it is basically a paralytic agent. It is given when you want the baby to be paralyzed. So, what are the indications in cases where you want the baby to be paralyzed or not moving? So, one is the mechanical ventilation. So, if there is patient to ventilator asynchrony, you would want to paralyze the patient so that your HFO, your whatever, can properly ventilate the lungs so that the patient does not fight against the lung. So to it is called to abolish the patient ventilator asynchrony basically. Example of this would be a baby who's PPHN and is on HFO, and you want to muscle relax the baby so that the HFO can properly, ventilate the lungs. Is one of the indications for Vecuronium in newborns. Next indication would be at the time of intubations. You do not want the baby to unnecessarily fight so that the visualization of the vocal cord becomes difficult, and it can lead to traumatic intubations, prolonged intubations. So you do not want such a case. So these are the two main indication. One and the third indication is at the time of general anesthesia. So now comes the compatible fluids. So what fluids are compatible? It's the normal saline, the half normal saline, the dextrose, whether 5%, 10% dextrose are the compatible fluids with Vecuronium. Now comes the administration. So either you can give a stat dose or a one-off dose, or you can give it as a continuous infusion, whether you want it for a continuous period. So start dose are usually given at the time of intubations, whereas continuous is when the baby is on HFO. You want to continue paralyze the baby, so then it's when the continuous infusion is given. So for the stat dose, we give it as 30 to 50 microgram per kg. Try to not to give it with succinylcholine. If you have given succinylcholine as a paralytic agent, you want to wear off the effect of succinylcholine, then only you would want to give to Vecuronium. Starting with continuous infusion now. So the dosing in neonates is 50 microgram per kg per hour is the starting dose. You can go up to 80 microgram per kg per hour, but any dosing above, like up for a older infant, you can go up to 800 microgram per kg per hour, but try avoiding that in case of newborns. I think my experience for 50 microgram, usually baby tolerates very well. Hardly we need to give it up to 80 micrograms, but do not cross over 800 microgram per kg. It's only for the older infants, or in babies who require longer doses, who's chronically on muscle relaxant, who requires it. Otherwise it's usually not indicated. Then comes the So let's discuss preparations now. For reconstitution, you need to take 10 mg of Vecuronium, that is there in the wild Vecuronium powder, in 5 ml of normal saline or any compatible fluid that you are thinking. So for a 10 mg in 5 ml will give you 2 mg in 1 ml, right? 2 mg in 1 ml. This is the standard. Or you can also take 10 mg in 10 ml. It will give you 1 ml is equal to 1 mg. So both type of reconstitution is possible. Now for continuous infusion, the reconstitution I told you about earlier, that is 5 mg in 10 ml, sorry, 10 mg in 5 ml, that is 2 mg in 1 ml. You will take that, and according to the weight, to this is the standard strength. Okay, so you'll draw up 5 mg per kg of Vecuronium, and you will dilute it in 50 ml of the compatible fluid, 50 ml of normal saline, or half normal saline, or 5% or 10% dextrose, whichever you are choosing. All right, so this is the standard strength. This reconstitution will give you an infusion rate of zero point 0.5 ml per hour is equal to 50 microgram per kg per hour. All right, 0.5 ml will give you 50 microgram per kg. So this is the standard strength. But in case of fluid restricted baby, you want to increase the concentration, you double the concentration for a lesser amount of fluid. So you draw up 10 mg per kg of vecuronium and dilute in 50 ml. There we were taking 5 mg, now we are taking 10 mg. So obviously we have increased the concentration, and the rate will become 0.25 ml per hour, will give you same 50 microgram per kg per hour. So we have decreased the fluid and increased the concentration if you are giving in a fluid restricted baby. If you can see, there was 0.5 ml per hour for 50 microgram per kg per hour. Now we have 0.25 ml per hour for 50 microgram per kg per hour. So if a baby has PDA or the baby is in fluid overload, you want to give vecuronium, but you want to decrease the fluid so that more amount of nutrition or something else you can give. So in that case you will give a fluid restricted dosing. And just a word of caution, fluid vecuronium is not compatible with the following medications, so do check before administrating. And also a word of caution here that these are the protocol that we follow in our hospital. The reference for my the dose for these dosing are from the references to sterile injectable drug handbook 5th edition 2011, and Take It Tomo et al. Pediatric and Neonatal Doses Handbook 19th edition, and New Facts 24th. Do cross check with the local protocols followed in your hospital. Thank you. Okay, well, let's have a quick example. Suppose you have a 2.3 kg neonate who's 10 days old and you want to start a standard continuous infusion. So, as I told you, you have to take 5 mg per kg of vecuronium, reconstituted fluid, that is. So, for the weight of 2.3 into 5 is 11.5 mg we need. Now, what did I tell you about the reconstitution? I told you that the reconstitution has 2 mg per 1 ml, and now you need 11.5 mg from this reconstitution, right? So if you do the maths calculation, it will come out to be 1.5, it will come out to be 5.75 ml is what we need from this reconstitution. You will add this 5.75 ml, I told you, in 50 ml total normal saline or compatible fluid. So you will add this in 44.25 ml of glucose 5% or any other compatible fluid to give you total of 50 ml, right? This is what I have told you earlier. Sorry for this. Now comes, so this will give me the concentration of 0.5 ml per hour is equal to 50 microgram per kg per hour.